and then urinary tract injury. Howard Sherb did a great study where they basically showed that overall they showed that gynecologists have finally learned how to do hysterectomy, which means that the percentage of urinary tract injuries is 0.73%, bladder is 0.66%, and the ureter is 0.02 to 0.04%. And they say the most common natural predator to the ureter is gynecologist, which probably may be true. If you do these procedures, you can fix them laparoscopically, ureter and the bladder. This is very old video where we're doing hysterectomy, and then we find ourselves looking into the Foley catheter. So again, the key is to know how to do suturing. So we sutured the bladder. When I hit the bladder, I don't even call urologist. We just fix it and that's it. But ureter is like a snake in the grass, and you gotta know where they are. And the best way is to find them at the pelvic brim, follow them all the way down into the pelvis, and then you see the relationship between the ureter and the uterine artery, the relationship between the ureter and the uterosacral ligament. I never use these Las Vegas stents because I think they are not beneficial, at least to me. After every hysterectomy, we do poor man's cystoscopy, where we use the three-way Foley. We clamp the Foley, backfill the bladder, and we use a 5mm 30-degree scope to put it inside the bladder, and we can see here. So you're always looking for the jets. If you don't find the jet, like in this situation, then you go in and you cut the stitch. So we cut the stitch, then we went back, there is no jet. And we did the resection of endometriosis on this patient. So before calling the urologist to put the stent, I decided let's follow the ureter all the way down, because we were already did the ureterolysis. So we basically followed the ureter all the way to the bladder, and we did not find any injuries on the ureter. So there was no stitches, no injuries. Then the urologist came and he put the stent in, and everything went fine. It turned out she didn't have kidney function. So sometimes, and this here you all have read in the books, if you put the medial trocar too low, you may hit the bladder. And this is exactly what happened. I went into my office and they calling me back and they said, come down here. So they did cysto, they found the ureter. And now I'm doing cystoscopy of the abdominal cavity here. And so there were two holes, because it's like through and through hole. So I opened space of Retzius and fixed the upper hole as well as the lower hole. And the patient did well, and that was it. She did well.